Depression, telling no.
What's up?
She's like,
Self-hatred.
why are we out here scamming? I mean,
telling
every single
no. Yeah.
See, off of that was like,
Mental
is this a place that I can
illness.
Did y'all see the?
Telling no. Diabetes
I
and
still got people writing about me talking about what I do.
telling no. Depression, telling no. Self-hatred, telling no.
It's been a long time coming. This has been my baby that I've been birthing for a while, sitting on it, scared to move forward, but thank you, God, I've moved forward. And today I have a very special episode that I am bringing to you. It's something that's near and dear to my heart. It's about the opioid crisis. Tonight we are going to be speaking about fentanyl. When I came back to Buffalo, New York, in my hometown of Lackawanna, New York, I was very surprised at the amount of fentanyl deaths that had occurred. And what I realized very soon is that this thing does not have just one face. It attacks anybody. You can be a woman, you can be a man, and it does not discriminate. Any color, any sex, it does not discriminate. So I decided to do some segments about it because I need to provide awareness. My goal and my intention is to learn, teach, and reach somebody because we need to stop these deaths. A lot of people are going to take these drugs. I understand that, but what we can do is provide awareness so that they know that they need to be aware of what they are taking. Tonight I would like to introduce Francesca, and I would also like to introduce Demetria. They both are here to help me with this segment. So Francesca, go ahead and introduce yourself and tell the listeners of the Vet Green Show now who you are and what it is that both of you do.
Well, congratulations.
Oh, thank you.
And thank you so much for having us.
Thank you.
I am the Executive Director of Buffalo Clinical Lab and Drug Testing Center, located on 2731 South Park Avenue in Lockport. In Lackawanna.
Yes, our hometown.
Lackawanna. 14218. We are open Monday through Wednesday. Walk-ins are available. We offer drug testing for both court-ordered tests or employment screening. We also provide testing, rapid testing for COVID, flu. We're very much so like Quest in our testing form. We can test for, like I said, COVID, flu, RSV, STD, urinary tract infections. Our purpose and goal is to serve the community for what has been lost. You know, you're from Lackawanna. We had a clinic that was abruptly taken away from us.
Yep.
So access to resources were removed from our community. So as a lab, we intend to bring it back.
Hi, I'm Demetria. Thank you for having us. And I'm the lab
course.
coordinator at Buffalo Clinical Lab. I'm in charge of community outreach and testing. And thank you for having us here.
Of course. Now, I do want to get into what it is that you do, but part of our conversation is what made you decide to open this lab, other than the lack of resources. You saw that there was a need, but during the opening, you also saw that there was a lot of drugs that a lot of people did not realize that they were taking, one being fentanyl. So what made you move forward with even expanding? Because you're a mobile lab. You started out as a mobile lab, but now you've expanded, and congratulations to that. I watch you, I do, and I see what you and your sister are doing. I'm very proud because I like to see especially women who are from my hometown that are doing something positive, and you are always doing something positive. And I think that is so great that you are doing this because it's needed.
Yes.
It's so needed.
Yes. Well, unfortunately, one thing that inspired me is health equity and the lack of accessibility to resources and information. Unfortunately, there are a lot of people in the recovery community that do not have access to the information to assist them with their journey successfully. So when we decided to expand, community outreach is important to us. So we're not looking just to bring you in and test you and then send you on your way. We have tools. We accept insurance. which actually helps to keep a person on track. If you don't have to pay for testing, you're not nervous about going to get a test because, oh, I can't pay. Now, if I'm in drug court, if I'm on probation, I violate because I don't have the funds to pay to be tested. So certain things we wanted to offer to allow people a successful journey in recovery. And I saw that wasn't happening, unfortunately. Except with the abrupt closing of our clinic, where are you going to get tested now?
Right.
The nearest lab was Quest in the
And that's
Southgate Plaza in West Seneca.
And you have to get you have to have bus fare or have a vehicle, because you can't, you can walk to Southgate Plaza, but it's going to take you about 2-3 hours.
Absolutely is. You know, we're right across the street from the Lackawanna Police Station and City Hall. So we're accessible, easy to get to. Our doors are open, and we're willing to help. We provide counseling information. As I stated, we accept insurance. We are a PAN facility, which means we offer public access to Narcan.
Okay.
No questions asked. That is a key part of your successful journey. For instance, a person may they may reuse. We want you to be successful. You can only be successful if you live.
Yes.
You need Narcan. You need to understand that you should not use alone. You should not be ashamed. There are no questions asked. There is no judgment. Come in, ask for Narcan, we give it to you. You want fentanyl testing strips to test the substance that you may use, we give it to you. There's no judgment. We want you to be safe. Harm reduction is key.
Why is it important now? Because I recently spoke to someone, and they told me that they test their marijuana for fentanyl. They have fentanyl testing strips. Why do you think it is so important to have these testing strips and not use alone?
Well, unfortunately, people don't know what fentanyl looks like. So part of the initiative that Demetria came up with is our Fear Fentanyl, the shirts that we're wearing.
And I love it. I love the message behind it.
And the reason being is because people don't know what this is, and you need to proceed with caution. Fentanyl, to answer your question, why should a person have fentanyl testing strips? Because you can't see fentanyl in certain cases. It's less or smaller than a grain of salt. It's odorless, tasteless. You won't know that this is in your system. And if you take it, you may have underlying conditions that can cause you to overdose. Mixed with other drugs, it can cause an overdose. But if it wasn't your intended drug of use, you won't know what's going on. So you need to understand what you have. We can't tell a person, don't ever do drugs. That's not reality.
Right, because the reality is a person's going to do what they want to do.
Absolutely.
And hopefully not die doing it.
Right, so be safe, be cautious. Harm reduction, it's key. You should test your substance to make sure it's what you were told it was. You should not be forced to take a drug you had no intention on taking. This drug is more addictive than generally the drugs that the person wanted to use, which unfortunately that's another spiral effect. It causes higher addiction rates, and it's deadly.
And you both are finding that a person will come in and they admitted that they've used cocaine, so you know that's going to show up. But a lot of times the fentanyl is showing up in these testing.
Most times. Most times when it is cocaine, fentanyl is present as well.
Because that's what they're cutting it with.
Unfortunately.
That's why it's so important that if you are using and you do feel that you need help or you don't know who to turn to, these are resources that you can use. You can go and get your test strips. It's very easy to use.
Absolutely.
You can even call the health department and they will send you Narcan.
Absolutely.
It's very easy to get these products. And don't be ashamed of it, because there's so many people with vices out there. You know, a vice is how I feel.
Agreed.
And one of the things that I want to highlight is that there's no reason to be ashamed, like you said. You may be addicted to something and you don't know who to turn to. Well, this show is going to help you with that. We are going to give you some resources tonight. Because that is the goal. That is the intention. I want to read some of these statistics that are out there. I do want to go into some of the statistics that are out there as far as Buffalo, New York, and what's been going on. So, and this is being reported by Spectrum News. This is where I got the information. From January through July 2023, 245 Erie County residents died of confirmed or suspected overdoses. I want to read that one more time because that is a huge number. It may seem low, but if you think about the number of people that are here in Erie County, 245 people, residents in Erie County died of confirmed or suspected fentanyl overdoses. Of those toxicology reports, 81% were cocaine and fentanyl. 81%. That is crazy to me. Combined, that's twice as many as in 2021. Additionally, people who died age 60 or older of overdoses has doubled. 60 or older, that means this is touching the grandmas and grandpas, y'all. This is, like I said, when we opened up, this does not have a face, this does not discriminate. It can be a 15-year-old, it can be a 65-year-old. This thing does not discriminate. That's why it is so important to be aware of what is going on. If you're going to use the cocaine, get the testing strips.
Please.
Go ahead and order them. There's no reason to be, it's better for you to still be here than not be here. It is better for you to ask for help. Even if you are not ready to go down that road of recovery, it is so much better for you to still be here and just order the Narcan, order the testing strips. I want to just move on. Let's talk about fear, the fear of fentanyl. Talk about where that came from and the meaning behind that.
It certainly came from a place of us now understanding through our testing and the shock of the people that were being tested, that they had no idea that fentanyl was combined in any substance they were using, especially considering that it was not their intended drug choice. So fear for us means education and caution, but it is not being spoke of impactful enough. Fentanyl's not, it's not discussed enough in school.
No.
It's not discussed amongst the community, in churches, with your family. There's a stigma attached to opioids and what community they actually affect. And also, to be perfectly honest, there's a stigma attached to fentanyl because people do not understand or they don't know that it is in the opioid drug classification. You need to understand what you're using. You need to also understand that the results of using can result in death.
Yeah. And I want to go back to what you said about our community.
Okay.
In our community, we did not necessarily see people addicted to the opioids. We saw the crack epidemic. We saw what it did. So we have this music out here right now that's promoting these drugs. Take the Lean. I was listening to a song today and they were talking about fentanyl and I was like, what? Like what? Like this is really being promoted? And like you said, there's a stigma in our neighborhoods, in our culture. There's a stigma that that we aren't affected.
Absolutely.
But the people that I'm seeing passing away that are dying are people that look just like you and I.
Absolutely.
Just like you and I. So yes, it is in our community. Yes, our community is being affected. And yes, this is a discussion that we need to have. This is a discussion that should be had at your kitchen table because these kids are out here partying. These are party drugs now. They're making them look pretty and making it, and you hear it in the music and making it seem like it is something that you should do to be on, that is something that's going to make you feel popular or something like that, which is ridiculous to me. We need to do a better job at talking about this because it is not something that's talked about at the kitchen table. Yes, get those test strips if you are a parent and you are watching this show right now. Absolutely. Get some Narcan in your house. I know a woman right now who came home and found her son dead in the car in her driveway. It was a heroin overdose. That is the worst thing that you would want to come across. We don't want to bury our kids, but this is what's happening. We are burying our kids. We have grandpas and grandmas out there right now who will never get to play with their grandkids because they OD'd on something called fentanyl. Let's get more into how you started seeing it come around. The first time that you heard about it, the fentanyl.
So for me, the first time that I heard about fentanyl was when my stepson passed away. His intention was to take a Percocet, and it was not. It was fentanyl, which is part of the reason why we want to bring education and awareness to this. If you are not being prescribed this Percocet, oxycodone, or any other pain medication from a doctor, and you're getting it as a street drug, it is packaged as a prescription drug, but it is fentanyl. So whereas he received it, he thought it was a Percocet, which is in music.
Percocet.
So it's seemingly safe because it's a prescription drug, and prescription drugs are safe. I'm going to take this. The intent was never fentanyl, and it certainly wasn't to die.
Yeah.
But this is my first actual encounter with fentanyl. And he came home on Friday. He passed away on Sunday. And like you said before, it's a party drug.
Yep.
So he was partying, and unfortunately he passed.
I'm so sorry that you had to go through that. That must have been very hard for you and your husband.
Extremely.
Yeah.
And his children, the mother of his children, his mother. We say recovery community because it is important that everyone understands that drug use and abuse doesn't only affect you.
It affects the family.
It affects the entire family. So as a family, you have to protect your family, so you should be prepared. You should have Narcan. You should have fentanyl testing strips. You should have the conversation. It shouldn't be a stigma. It shouldn't be shame attached. He didn't understand that drugs were not what they used to be.
Yeah.
That since 2020, there's been an influx of what's called bad pills. They're not bad pills. They're just not what you thought they were. So, you know, yes, the opioid crisis has been around for a while, but this isn't just that. This is disguising pills for something else.
Yeah.
And they're fentanyl, and like I said, they're resulting in death. So,
What was your first encounter? How did you even get to know what fentanyl was?
I learned really a lot about fentanyl at this job, but I actually had a lot of encounters with overdose, a lot. My grandfather had an aunt who recently died this year of an overdose. Addiction runs really, really, really deep in my family on both of my sides, my mom and my dad's side. So it was nothing new for me to see addiction or to be around addiction and people of recovery. I'm used to it. So it's like being at home, to be truthfully honest.
Yeah.
Fentanyl is just worse. You die instantly. A little bit, a
grain of salt.
A grain of salt is enough for you to die. So you think, okay, I'm gonna take this pill. You're not gonna take that pill.
Yeah. Taking that pill could lead to your death. Taking that pill to party, and I overstand this music can be so addictive to listen to, and it makes you feel a certain kind of way. You get in this trance, and it's like, yeah, I want to be like that star. I want to be like Future, Percocet, Percocet. Oh, I want to take this Percocet because they said that it's going to make my sex drive even better. It can lead to death. You may not be able to get up in the morning. You may not see the next day. It is so important, and I do not want you to not take anything. I want you to take from this show that you can die. You can die. You are out there partying right now, and you don't know what you're taking. You don't know what's in that drug. I know your friend may have given it to you and said it was okay. And you may have seen them take it, but your body may react differently to it. There's so many people out here that are dying. It hurts my heart because I look at these babies. Because the demographic, I know what the demographic, the statistics are saying, but what I'm seeing are these babies, those kids that were born in the 90s, whose parents were addicted to crack cocaine, and now they have this addiction, and now they're doing these drugs as well. I see a lot of that happening. And I just want to provide some awareness and also provide a place where people can have a safe space to talk about it. The Vet Green Show is open to talk about it. I want to put that out there as well. This is going to be a monthly segment. It's something that's near and dear to my heart because I saw what drugs can do to communities. I saw what the crack epidemic did to my community. I saw parents turn into what they call fiends, and they begin to sell the furniture. I saw people not having food to eat because of the drugs that were running rampant in our community. And I'm thinking, wow, like this is even stronger.
The biggest
like fentanyl
difference
affects your body.
Right. So versus living with it, you die. And there's no other way to put it. You get it, like you said, the music wants to romanticize it.
Yeah.
They want to glamorize it, make it seem like this is a social class drug. And if you use this drug, you're at a certain level socially or class-wise. Yeah. But what is not being said is that you will die from using this drug. It was not prescribed to you. You do not know the dosage. You do not know what else it was mixed with. Another thing that's important is what to do, and that's part of the education, what to do if an overdose were to occur. People usually are scared to call the police if they witness someone during an overdose.
Yeah, the person that I know got left.
Right, that's what
left.
happens. Part of our education is if you call the police, you are not going to jail for saving someone's life. You're not. If you are there and you call the police to help prevent someone from passing from an overdose, you're not going to jail. A lot of people are scared, thinking they're going to go to jail. I'm guilty. Oh my God, I was here. You're not.
I was a part of it.
You're not.
Yeah.
You need to understand that you need to save this person's life, and that is first and foremost. You call 911. And also, CPR is important, and access to knowing how to perform CPR, which we will be offering next month.
Okay.
It's our CPR classes.
Okay. Do you also offer classes on how to administer the Narcan?
Yes, that's
Let's
coming
talk
as well
about
with that because that is important. It is important that the Narcan, if it's the nasal spray, which is what's available to people to not purchase, but that's what is being sent out to people through the New York State Department of Health, and that's what we have as well. It's important that you use it in one nostril at a time. It's also important that you understand that even when a person, if they're unconscious and they become conscious after you have, you administer it through the nose, you spray it up there, you hold. When they resume consciousness, you still have to call 911 because an overdose can take place from 1 to 3 hours.
I did not know that.
Yes. So that means that even though they're okay, Narcan will only last for 30 minutes.
So they need to get
They
to the
have to
hospital.
get to the hospital for further medical treatment. So the Narcan can wear off and they can go back into overdose if you never call the doctor. If you never take them to a doctor, if you never call the hospital, if you don't do that, you can go back into overdose. People don't know this, so you may say, oh, Narcan was enough. It's not enough. They need to seek medical treatment immediately.
And stay there till the police get there.
Absolutely.
And don't worry that you're going to go to jail. As
Please
they
don't.
said, what you're doing is actually saving someone's life. It can be a matter of life and death. If you leave them there, they could die.
Absolutely. And like I said, that 1 to 3 hour time frame is crucial. Most people aren't medical professionals, so they don't know that you're still in jeopardy of overdose within that time frame. So unfortunately, like I said, if you have the Narcan and you use it, a person is revived, You think they're okay. They're not.
Yeah.
Have to go to a hospital. And that is the most crucial part of using Narcan. You don't administer another dose until 1 to 3 minutes and you see that they have not resumed consciousness. Then, because you usually get 2 nasal sprays to use in one box, then you use the second spray in the other nose that wasn't used, and then you try again. You don't use the same nostril for the spray.
Okay.
So you alternate.
Okay. That is very useful information. Very useful information. Thank you for that.
Absolutely.
I think I was talking to my son about the show. He works with kids and he does tutoring, and they actually had to learn how to administer Narcan. And he said it was one of the scariest things ever, because it really is a matter of life and death.
It absolutely is. And it's even scary. An overdose to witness is scary. A person may will lose consciousness. Demetria, you know how to check for overdose if it were to occur.
Yeah.
Dilated pupils, shallow breathing. This occurs, you know you need to administer Narcan.
Have you ever had an instance where someone came in and they had OD'd?
They were in the process of. They were throwing up.
Jittery, wouldn't sit down, sweating, really, really bad. Sweating really, really bad.
They were on the verge of passing out to the point of being unconscious. So medical treatment was extremely imperative. And that's what happens. And they came over because they knew they took in something. They didn't feel, it wasn't the normal high that they had experienced. This was different and it was alarming. And when we did the rapid test, unfortunately the person thought that they had only had cocaine, but it had fentanyl as well.
I also want to just talk about, how this even started, because fentanyl was actually made to help during surgeries. It was made in 1959, and I will look up the doctor, but they administer it a lot. I was talking to you both about my daughter. She recently had a surgery, and I was surprised that they had given her fentanyl during the surgery. Like, I was like, wait a minute, what? Especially, like, come on now. And they tried to give it to her when she came home. My son, he hurt his back. They offered him fentanyl in the ambulance, which surprised me. It surprised me and it alarmed me because of the way, the addictive nature of fentanyl.
Okay.
But as you said, it can be useful in certain instances. I think that you really need to know yourself as far as the drugs. If you have an addictive nature, there's other options that you can use as far as pain. If you are using cocaine, again, I do not want to scare you, but I do want to let you know that you need to test it, and there's ways to test it. How do you use the testing strips?
Testing strips, what you do is it comes in a packet, and then you put your substance in the packet. You add water.
And don't be scared that you go lose too much of it, okay? It is a life and death situation. I'm just keeping it real, because I don't want to put, that's too much. No, it is a life and death situation, okay?
Absolutely. And, to be honest, use, like you said, don't be scared you're going to lose what you have.
Like, I got an 8 ball, so what?
Right. What you need to do is you need to test it. You need to put it in that packet. There's an amount of water you put in there. And then it's mixed, and you put the fentanyl testing strip in there, and you test the sample substance. So it doesn't have to be a lot. You test the sample amount, and it will make you aware on the strip if fentanyl is present in that substance, and if what you have is actually safe to use. And it is important to not be a daredevil. It is important to not take the risk, to not play Russian roulette, because you are truly... Fear Fentanyl campaign is to make you aware that this is something that you must proceed with caution with your recreational drug use, because this is not the intended drug that you chose to use. This drug should only be used in the presence of a medical professional providing the proper dosage. Not if it's packaged as one thing and it's presented one way, but you're taking something else. You don't know the dosage. You don't know what else it's mixed with. This isn't crack. This isn't meth. To be honest, we know people that have been on crack for our entire life.
Yes.
For many, many, many years. I mean, in our community, we saw what the crack epidemic has done. It didn't necessarily kill people, but people lived in ways that they hadn't before. And for a long time, this is not that. This is far from that. This will kill you. Your chances of survival are much less. Like you said, 2/3 of deaths are fentanyl involved usage. You don't hear that with just using cocaine or crack. And this isn't me promoting or condoning the use of any drug, but it is me explaining how the serious nature of this drug in particular, it must be dosed properly. And it must be under the supervision of a doctor or a medical provider, healthcare provider. If not, you don't know what's going to happen. And that's why people are dying. That's why children are dying. It is important to use and be socially responsible and to keep your drugs away and out of the reach of children, pets, because unfortunately people are getting access, kids are getting access to this thinking it's something else. Again, it doesn't taste like anything. It doesn't smell like anything alarming to make you say, oh, I don't want that. So instead it's ingested or absorbed through the skin, and now someone has passed. A 1-year-old in New York City at a daycare.
That quick.
Yep.
Laying on the mat.
Yep.
So,
I mean, it is important to understand what this actually does and what this looks like. And people need to speak about it when it affects their family. So people don't think that this, oh, well, it could happen, but I heard it happen, but not to us.
right, because it can.
Absolutely.
This thing does not have a particular face. I cannot stress that enough. This thing does not have a particular face. It affects everybody. This is
Absolutely.
becoming one of the leading causes of deaths here in America, fentanyl overdoses. And again, it does not, the age range is very broad. It's very broad. You have children dying and you have grandparents dying. That's a large age gap. That is huge.
Now, to speak to the senior community that is dying from this drug is because, again, it is presented one way, but unfortunately it is not what they're looking or intending to use. So if you have a person in the senior community who has a high copay and need pain medicine,
Oh, wait.
and they think that that's what they're getting for a lesser amount with street drugs, this is why they're dying.
And that is real.
So, oh no, okay, so the copay is $100. I don't have that yet. I only have it in the beginning of the month. Buy it
on a
off the
fixed
street.
income.
I'm on a fixed income. You buy it off the street for $3 a pill. That's easier than buying your 30-day supply.
For $100.
Exactly. But it's not your pain medication. It's something you've never had before. Now it's highly addictive. So now if you didn't die from using it, you're making yourself more accessible to it and vulnerable to the effects of it because it's addictive. So now you don't even want your prescription medication anymore. Now you're solely going and using this.
Because that fentanyl is in there.
And the higher probability of use can result in death. Because like you said as well, you don't know what it's going to do. It may not happen the first time
Yeah.
or second or third because people who are providing, they're not doctors, they're not scientists, so you don't know the dosage that's in that particular batch that you received.
And don't think just because you know this person and they wouldn't do that to me. You
Great
don't know
point.
where they got their dope from. You don't know what it's cut from. A lot of times they're getting their dope and they aren't using it. They're just distributing it to get the money.
Absolutely.
You have to understand that you have to care about you in this thing. I know that, you want to party and all of that. I partied for a very long time. But then it's like, okay, when do you stop? When do you realize that you are worth living, that your life is worth living. This fentanyl thing has just gotten out of control.
Absolutely.
And it's like it's spiraling, and I see people spiraling, and it's kids and it's grown-ups, grandparents. Like grandparents, are you kidding me? This thing is just becoming, it has taken over our lives. It's taken over our communities. And we are standing by like it's not happening, but it's happening. It's happening in our community, y'all. It is happening. You see these kids walking around looking like zombies. Chances are they are high off of fentanyl, cocaine, and ecstasy. And this stuff is being cut with these drugs.
Yep.
Fentanyl is like, instead of using baby powder now,
Right.
they are using fentanyl because it's cheap. And it keeps people coming back.
Right.
It keeps them coming
And
back.
due to the addictive properties, it absolutely does. And it's unfortunate. And the language behind it doesn't reflect the serious nature of it. Like someone may say, oh, well, that person got a bad pill. Please understand that there are no good pills with fentanyl. This person didn't get a bad one. They reacted the way that they would react. The same thing can happen to you. So there's no bad pill. If you're using drugs and you're getting street drugs and fentanyl is present, it's not a bad pill. It's just they're all bad.
They are.
Because they're not what you think they are at all.
Yeah. I just want to give you a little bit of information about fentanyl. So fentanyl was first developed in 1959, and it was introduced in the 1960s as an intravenous anesthetic. It is legally manufactured and distributed here in the U.S. The problem is that people start realizing that, oh, I can use this thing to cut cocaine with, and I can make a lot more money. If I cut my cocaine, if I buy an 8-ball of cocaine and cut it with fentanyl, that means I'm going to make a lot more money. That became the problem. And they aren't caring about what it is that you are doing. They just want to get the money. They just want to get the money. I just want to also get into the fentanyl epidemic. So the third wave of the epidemic began in 2013. So they began to see fentanyl, but it did not become an issue until around 2013. As an increase in deaths related to synthetic opioids like fentanyl, the sharpest rise in drug-related deaths occurred in 2016 with over 20,000 deaths from fentanyl-related drugs. And I know that it had to increase during COVID, because people just began to mentally break down, didn't know what was going on, just like all types of abuse increased during COVID. I'm sure the fentanyl abuse during COVID. Fentanyl abuse happened during COVID.
Absolutely.
Now, I also want to talk about how did we get here? How did we get here with this fentanyl that now we're sitting on the couch talking about it? Like, this is a thing right now.
Like you said, COVID. And it was due to not having access to treatment, healthcare, because the hospitals are overran with COVID patients. You have other people who have other needs now using street drugs to assist with those other needs, be it pain management, be it anything. They're using different alternatives to meet their needs and requirements for their health situation. So now you're abusing these drugs. Now you're addicted to these drugs. Even a person who may have already been in the recovery community, now you have more access to this and no access to your programs that help to keep you away from drug usage. Horizon wasn't open. You couldn't go to your weekly meetings. So if there was a boom, and it was during COVID, it's also due to everything else being shut down that helped a person in their recovery journey. Things didn't open back up. There was no recovery homes or rehab available. Things were shut down. So now you have a person to simply deal with their addiction themselves. And that's where part of the increase came from.
Yeah. So what do you suggest we do now? As parents, as just citizens, as just regular individuals, what would you suggest that we do now to try and help combat this thing, because it's going to take a village. It is going to take all of us to combat it. We have to continue talking about it. It can't be a discussion that's just behind doors and you think it's embarrassing to talk about. I lost my child to it and it's embarrassing to talk about. Talking about it may help someone else save their child. I know that it hurts. Listen, that is the worst thing that I can't even imagine how that feels. I can't even imagine. But if I, as a parent, can do something to help someone else's child, I'm willing to do that. I'm willing to continue having the discussion. So what would you suggest that we do, just as individuals? What can we do, including the Narcan? I got some from the health department. I got my 2 boxes. I was talking to a young lady, and she told me she was riding down the street and saw someone overdosing, like on Bailey Avenue, had OD'd. It can literally save a life if you have it in your car.
If you have it in your car, if you call 911, people are not talking about this enough. The education isn't there. The resources aren't there. And people are simply failing to act. It's like they're stuck. So there must be, part of our fear campaign, there must be action after the education. So you're educated as to what to do, what an overdose looks like, what you need to combat that, the steps that are necessary. What is your action? And who are you speaking to? Who's your audience? It should be everyone. You shouldn't say, well, we don't want to say that around the kids. No, we need to say this around the kids. Oh, no, this isn't a drug that, no, don't say that. Just say overdose. No, say fentanyl. Say it. Say the name. Say what it is. Make it more common. If you say fentanyl, some people still don't know what it is. So you can't bring awareness to something that's a secret or that's looked at as shameful, or if a person thinks they're going to be judged. Remove judgment. Be a human being. Be a human being and just talk and just have honest conversation, because it's nothing to be ashamed about. People are addicted to any and everything. There's no addiction better than anything. No addiction is better than the other. At the end of the day, in order to combat this, there must be discussion and there must be action. We have to get into schools. We need to be in community centers. It needs to be spoken about at church, at home. This has to be an ongoing, what needs to happen is what happened when I was a kid in the 80s.
I remember.
I have to say it. So when I was a kid, we came home to after-school programs. And those were important because it was the discussion after a discussion. Then in the 80s, you had Nancy Reagan with the
DARE program.
Yes, DARE and your brain on drugs. This is your brain on drugs. Any questions? There was so much information and media coverage to where this is why there was a stigma. Because you looked at certain drugs like, yeah, right. No, I'm not going to do that. This was the thought process. This is not occurring. Instead, you have music that promotes it. You have a society that thinks you've gained a social status if you use it. So to combat this, you need to provide honest facts of what this looks like and what it's doing to every community. Artists have suffered loss. We have lost people that were impactful in their career as actors, singers, who will never hear their voice again or see them in a project again because of fentanyl. And it needs to be said. Now their art is lost forever. We will not see them anymore. This is due to fentanyl. Say what it looks like. Say what it means. And no one's doing it. Like I said, it needs to be in church, community centers, after-school programs need to speak on it. All the community centers with any after-school program needs to teach every kid how to use Narcan.
Talk about it.
Every community, church, you should pass it out. They'll give it to if you call New York State Department of Health as a facility, they'll send you boxes of it.
Yep, I got my 2 boxes.
Pass it out in church. Why not? Why aren't we speaking about this? It just can't be a secret, and you can't be stuck when you hear it. You can't just clutch your pearls. You need to act. You need to do something. You need to be a part of the change that you want to see. And our community needs it. It deserves it. It deserves it.
We have to stop looking at it as if it is not something that affects our community. And I'm not only just talking to the Black community, I'm talking to the human community as a whole, because again, this thing does not have a face. But I also want to address our community because I know how we react to certain things, and it is something that we don't think is affecting us. We just don't. We didn't see the pills affecting us. We saw the people that were addicted to crack cocaine. So we don't think that it is in our communities, but it is. These kids are taking these drugs. If your child is coming home and they look high or something, maybe you should have the discussion with them. Talk to them about who they're hanging out with. Make sure that you know who it is that they're dealing with, because chances are, if their friends are doing drugs, your child may be introduced to those drugs as well. I know we like to think that our kids are going to listen to what we say, but unfortunately, we have a lot of children out there that are looking to be accepted. They are looking to feel as if they belong, and a lot of times the groups that they're in, their belonging means that they have to do what they're doing. And that could mean the drugs.
As a parent, I was trying another suggestion that I have as a parent, if you have any suspicion of drug use, you should bring your child for drug testing so that they can understand the seriousness of it as well. This isn't a secret. I'm not just going to have a simple conversation with you and say, no, you shouldn't be doing that. Bring them in for testing. Let us test them. Again,
we take insurance.
We take insurance. It's of no out-of-pocket cost to you whatsoever. 100% private, confidential, and discreet. So no one knows any information outside of the lab that sends you the report. Get your child tested. Find out what they're using. You may be surprised.
And they may be surprised.
Absolutely.
They may be surprised. They may not even know that the cocaine that they've been using or the pills that they have been popping is laced with fentanyl.
Absolutely. Absolutely. Get your child tested. If you have a child living in your home, get them to if you even have a person in your home, a child in your home who's using, make them test every week. Because you never know what substance is included in the drug of choice that they're using.
And it could literally be saving their lives.
Absolutely.
It can literally be saving their lives. I want to go into a little bit about the Narcan. A lot of people don't believe that it's something that should be readily available. They think that it's just promoting drug use. What are your thoughts on the Narcan and how easily accessible it is? Like, even though it's easily accessible, we still aren't getting it. But what are your thoughts on the Narcan?
I think that it's going to save a life. And the goal is to save a life, to start the recovery process. That can't happen if someone passes away. So the stigma that this is promoting use is promoting life. It's not condoning use of drugs in any way. It's being responsible. As I stated, it's promoting living. It's promoting recovery. You can't recover from something if you're dead.
Yeah.
So you need to have this. This is just a tool for recovery. It's a tool for safety and harm reduction. It's nothing, it should not be equated in any way to permission to use. And I know people often want to say that, but that's your bias, those are your personal feelings. But in reality, you are saving a life. Yeah. And you can't enter a person into recovery if they have passed.
Yeah. And the recovery has to start when they are ready to start. So even though they may not be ready to start, you can at least help them save their life by having the Narcan available, by having the test strips available. If you know that they're going to go out and do this thing anyways, you throw condoms at them, throw some test strips at them.
How about this fact when you stated about children? So if there's accidental use or exposure and you don't have Narcan, how do you save that life? Unfortunately, there is stigma with people who have addiction. And, unfortunately, people may use the term addicts, which we do not.
I like that you don't use that.
No. You may say addict, and then you say, well, it was their choice, so if they die, oh, well, I've read these things. When Narcan is being offered, you'll see a Facebook ad from New York State Department of Health, and it talks about how you can access Narcan, and then underneath you have terrible comments. But what about the child that uses accidentally? They don't deserve to be saved. You don't know the situation.
Yeah.
So you should not judge, and everyone should be prepared.
I think we as human beings need to stop the judgment, because you never know. It can be affecting your family and you don't even know that it's affecting your family, because this thing is so hidden, I feel. I really had to do a lot of research on it, and it's like, it's not being talked about in the schools. I can remember in the 80s, the crack the egg and this is your preying on drugs. I remember that. We need more of that. We do. We need more programs for these kids to highlight what they should be looking for, and make sure that they have access to things like Narcan. I agree. Have them in the schools. Have them in the churches.
We called a few high schools. They weren't interested.
Really? They want to act like it's not happening.
They don't even want to put you through to the person that you should be speaking to.
I can remember in high school, this was in the 1990s, and one of my classmates had a $400 a day addiction to crack cocaine in high school. I can remember that. I can remember sitting in class, and we were talking about it because he was out of school. The teacher happened to ask, and I guess the teacher was close to the guy. He happened to ask another one of the classmates because he had started skipping school. I'm in the 10th grade. At that time, he had a $400 a day addiction to crack cocaine. The players change. The drugs get even better for people. The access gets even easier. It is happening. It's happening. I know we like to turn a blind eye and act like this is not happening in our communities, that it is a white thing, but it's not.
No.
How many people have I spoken to that have been affected? Everybody. I spoke to someone that's on a board, and his tenant, who was a teacher, passed away from fentanyl. They did not even know that he was using cocaine. He was a teacher in the Buffalo district, passed away from fentanyl. So it's happening everywhere. Again, it does not have a face. It can be that person that you're talking to right now.
Absolutely.
Start the conversation. Start the conversation.
Absolutely.
We have to.
It can literally be anyone. Demetria can tell you more. She tests more often than I do. I handle a lot of back end, our contracts and proposals and things of that nature. Yeah. But you can even share the people that you encounter. What do they look like?
Young. The people that I encounter on fentanyl look young. They usually look well dressed, well groomed, hair done nice. You would never guess that that's their drug. It's not even their drug of choice. That's a drug that they had took. It's never their drug of choice. No one wants to take fentanyl.
That's a good question. Not to cut you off. Have you ever had an instance, Demetria, where someone said that they were taking fentanyl?
Never.
Never.
No one wants to take fentanyl. You take it on accident. You don't know what it's cut with. What happens is when they cut it, it makes it stronger and better. Because fentanyl is very strong and very addictive. So now I have the best drug, and it's addictive, it's stronger, but I'm killing people. And that's how it happens.
And that's what, I have the best stuff out here on the street, so people are going to continue to come to me.
It's extremely addictive. Now, even if the doctor prescribed it to you, they don't tell you how addictive the drug is. Like you said, you went through certain instances with your children, and they're offering the drug or whatever the case may be. I know they didn't tell them before they took this drug that it was addictive.
Yeah, not at all. Good thing. See, I because of where we were, and I saw the crack epidemic, I had the conversations with my kids. I had those tough conversations. If someone comes up to you and asks you to sniff something, like I got on my kids' nerves because I knew what we were facing. And I knew when they went outside, it was going to be a different environment. And I wanted to make sure that they were educated before they went outside. So I did that. Thank God I had those conversations. But a lot of people do not have those conversations. We don't even think to have those conversations.
Absolutely not. You would think if your doctor prescribed you something that's safe for you, it could save your life, but it's the same drug that's killing us. The same exact drug that's killing us. Or the dosage, if you never self-medicate, never, I'm going to take a second one, because these are not the drugs that you need to take a second one of. These are the same drugs that can kill you.
Right. You need to take as prescribed. Even if you were prescribed fentanyl, you have to take as directed by the physician. It's not a drug because it decreases respiration. So the more you take, it suppresses your breathing, and so ultimately you stop.
And to talk more about the highest euphoric high, you get extremely high off. It's like being on a cloud or a pillow. This is the way that the people in recovery
Explain
describe the high that you feel. So this is the highest you have ever been in your life. Why would you try it again? But they are.
Right.
How do you explain to people when, do you tell them that there's fentanyl, that they came up testing positive for fentanyl?
Our process technically is we send the results to court, and because they sign a release for us to release the information to drug court, the drug court person may tell them, or the judge, but we also send them the information too.
Yeah. Have you ever had an instance where someone came back and was like, that has to be wrong, like I didn't take fentanyl?
No. We have never had any test question.
Wow.
Never. Because if they're testing positive for fentanyl, the other drug they intended to use comes up as well. So they know that they encountered a substance. So fentanyl, being present at the same time, they understand that. They understand it. It's just unfortunate it wasn't their intent. But they'll say, I took cocaine. Well, there's fentanyl as well present. And then, everyone that we had so far is surprised.
I do want to provide for anyone who's out there who may be struggling right now with recovery, because a vice is a vice is a vice is a vice. There is no judgment here. This is truly a safe space. There is a national hotline for anyone that may need help. It is confidential, and that number is 1-800-662-4357. Again, that number is 1-800-662-4357. I don't want you to feel as if you are alone. I know personally how it is to deal with the opioid crisis, because I was someone who struggled with it for years. I've had over 15 surgeries, and I remember my ex saying that the doctors were just legal drug dealers. And before I knew it, I was taking it to just numb my pain. The pain was gone, and the doctor was prescribing it to me. I told you that I just got prescribed morphine, which I'm like, wait a minute,
Right.
like that's something that people get when they're in hospice.
Right.
You know?
Absolutely.
Yeah.
Absolutely
so it
is.
scares me.
Absolutely.
It scares me, but thankfully, I have, pain management who helps me with that. So if you are someone who has been struggling or know someone who has been struggling, have the conversation and don't be embarrassed to talk about it. Like, it's something that I'm not embarrassed to talk about, because it's a part of my life. It's something that I'm gonna have to deal with for the rest of my life. It's something that I know that I was able to overcome, thankfully, and get treatment for. But everybody is not like that. That's not the case for a lot of people. A lot of times we are embarrassed to talk about it because we think that we're alone, or we think that we're going to be judged. I say to you, don't worry about the judgment, worry about your life, because if you're still here, that means that you're meant to be here. You're placed on this earth for a reason. If you know anything that I promote life. I promote that you are here for a reason. We all have been purposed here for a reason. And sometimes we do get caught up with the drugs, and sometimes we do get caught up in that party life, but you can overcome it. And sometimes we do need help. And it is all right to say, I am not all right. It is all right to say, I need help here, and not be embarrassed about it, because you are not alone. When you go into these treatment centers, you will see so many people that look like you. And maybe, yeah, you will have to find a treatment center that works for you. And maybe, yeah, it did not work the first time, but maybe this time it will work. Maybe this time watching this show will help you, guide you to some help, something that will change the way that you think about fentanyl, something that will change the way you think about your own life, because you are worthy of living. And that's really what the goal of this show is, to teach, learn something myself, and also provide guidance and awareness.
Absolutely.
And I thank you both for doing that tonight.
No problem.
And I welcome you back to the show anytime. This is going to be an ongoing segment, because I saw firsthand what the crack epidemic did to my community. I saw firsthand and was a part of what the crack epidemic did to our community. So it is my goal to provide, this is me giving back, because I don't want anybody else to die from not being aware, or die from something that they are trying to use and not even knowing that it's laced with something else. I've seen people break down because they've had to bury their child because the child thought they were taking a Percocet and they were taking something that was laced with this drug called fentanyl. It is the F word that is not spoken about. It is the F word, I feel like, that is killing so many people in our communities. And it is time that we stand up and do something about it.
Absolutely.
And I know a lot of people aren't going to agree with what it is that Narcan can do, because they think that it is promoting it, but it is actually saving a life.
Yeah. One thing that's important is, I do want people to understand that if you do not have an address to have Narcan delivered to you, or the fentanyl testing strips, you need to know where you can go pick it up. Because the state will send it to you, or Erie County will send it to an address, but what if a person doesn't have one? That is important, that people are made aware how to access it. And again, we have it readily available. You can simply come pick it up from us. If you cannot, or if you do not have an address for the state to send it to you, you can simply come get it from us.
Yeah, and where are you? Tell everyone the name of your facility and where you're located and your hours of operation.
Absolutely. We're Buffalo Clinical Lab and Drug Testing Center. We're located in Lackawanna, New York, 2731 South Park. You can pick it up between 9 a.m. and 5 p.m., Monday through Wednesday. It can either be the fentanyl testing strips or the Narcan. We have it available. If by any chance we run out, you can go to your pharmacy
and pick it up.
I've
seen the signs, Narcan available.
And you need to, people have to be educated, because in some pharmacies, people are not aware. Some of the pharmacy techs weren't aware. We did a social experiment.
Yes, we did.
We went to different pharmacies to see if they would provide us Narcan.
It's supposed to be considered free, or $5.
What happened?
And we went to a few that were not educated on it and did not give it to us.
What was the holdup?
Oh, you need to pay $45. That is not what the state says.
Wow.
We were turned away from a certain pharmacy. And then there was other pharmacies that we had to ask for the supervisor, who overrode the fact that we needed to pay. And then they allowed me to get it. The thing is, we want to make sure that when we provide information, we provide correct information. So when we tell you we don't have it, we'll tell you where to go where it's hassle-free. We've done the research. We're out in the field. We're not just speaking on things that we hear. We literally rode to several pharmacies to see if this was accessible for people. In some cases it is, and in some places it's not. The ones that have it readily available, no questions asked, and that's what it's supposed to be. No payment. We will let you know. You can also, our phone number is 716-256-2011. You can call us and we can have the conversation. We can direct you, tell you where to go or what to say.
No judgment.
No judgment. None whatsoever.
You are here to help.
Absolutely.
Yeah, what is your goal with Buffalo Clinical Lab?
Our goal is to expand to a clinic.
Absolutely.
With different providers providing women's health, counselors for the recovery community, and treatment. That's our goal.
You see a need.
There's definitely a need. There aren't enough hospitals in Lackawanna. We have people in the area, transportation is an issue. We're right in the heart of the city of Lackawanna, which means people can walk to us generally within 10 to 15 minutes. Literally. From
Right in
any
the
place
middle.
that you're at in Lackawanna, you can come to us walking within 10 to 15 minutes.
Yeah.
So there's no reason why we shouldn't be able to provide to you everything you need so that you don't have to go without. So that's the goal.
My goal is to continue with our outreach program and to make sure we go to different communities all the time and extend free health care for them and free testing. And I want to continue with that and double our outreach
She
program.
loves community outreach. She does amazing with the community outreach.
Where does that come from with you?
It comes from the love of helping people.
Yeah,
Yeah, I love to help people.
yeah.
And we have a need for it right now.
We do have a need.
Yeah.
And we need more people like you, like the both of you.
And thank you. But also, it's not just Lackawanna. We're mobile. So if there's a need for testing, we can come to you. And we have enough staff. We can make it happen. We're not understaffed. If there's a call, we can come out. Our initial, like you said earlier on, we're mobile. We're a mobile testing center. So if there's a need for us, we can come wherever you are.
What's the phone number again?
716-256-2011.
And are you on social media?
We are.
Okay. All
We
right.
are.
Where can they find you on social media?
Buffalo Clinical Lab and Drug Testing Center.
Okay.
You send us a message, give us a call. Like I said, if you need testing, we can come to you. And that's any testing. But if there's an emergency, we can bring Narcan too. We'll do that as well. Testing strips as well.
You guys are phenomenal
Thank you.
and doing a fantastic job. Thank you so much for joining me on the very first episode of The Vet Green Show. I was just
you.
about to say Think and Grow with Vet Green, but The Vet Green Show.
Thank you.
This is very near and dear to my heart. And again, I welcome you back on the show. This is going to be a monthly segment because I need to reach these kids. I need to reach these individuals. I need to let them know that their life is worth living and that they are not alone and that we can provide resources. We can provide information that you need that you may not even know about. The Narcan, I did not know about that as far as the pharmacies. So thank you for that as well. She also provided guidance on how to administer the Narcan. If you can just say that one more time just so that they are aware, because I wanted to get to everybody.
Please understand with using Narcan, it is one nostril per use. So if you've already administered into one nostril, if you have to use it again to revive someone, you need to use the opposite nostril that you used. You also need to be with that person until medical treatment arrives. So if you need to call 911, an ambulance needs to come and get this person because accidental overdose is between 1 and 3 hours long. Narcan only lasts for 30 minutes.
So they have to get to the hospital.
They absolutely have
There's
to.
a window that you
It is.
have of 30 minutes.
30 minutes. After 30 minutes, they can go back into overdose. What if a situation were to occur that to revive them, you've already used the 2 that come in the box? So it is imperative that the first thing you do is call 911 so someone is on the way. The clock is ticking from the time that you first use it. So within that 30-minute window, someone needs to be coming. You need to have 911 coming. The ambulance needs to come. Because, like I said, I can't stress enough, it's 30 minutes. An overdose is between 1 and 3 hours. After the 30 minutes, they can go back into overdose and you're not prepared.
Wow. Thank you.
You're welcome.
Thank you so much.
Thank you for
I
having us.
really
Absolutely.
appreciate it. Absolutely. Again, thank you to everyone who has watched the first episode of the Vet Green Show. We are coming back again. This is going to be an ongoing conversation. This is going to be a monthly conversation. I have some other shows down the line as well. On Wednesdays, I am going to have my mindset coach, Coach Bree. So make sure you catch me on Wednesdays. I will be live at 8 p.m. Thank you. I can't believe this is here. Like, I can't believe it. So thank you, everybody. I love you. I love you much. Love you long life. This is the Vet Green Show. See you when I see you.